There we are. So now, can I just welcome everybody? Welcome Professor Robert Howarth. Thank you so much. It seems absolutely amazing to have you join us. Your work is incredibly important to us at the minute. It feels like a lifeline, and we're terribly grateful. And thank you very much. And Dr. Kathy Nolan, who has been on this journey with us now for some time and helped us so much when we were trying to make the submissions into the Hatch research. And that's been wonderful. And Mr. Mark Ruffalo, that's wonderful. As Carroll O'Dolan has already introduced you as our shiny thing. Thank you very much for joining us. And Dr. Carroll O'Dolan, again, thank you for being here with us as the medical doctor, speaking about the health of our community. So Mark, would you, before we all start getting into the technical things, would you like to tell us, say a little hello to everybody, and we'll come back to you then when you've heard our situation now.
Yes. First of all, I just want to thank everyone who's tuning in. I mean, I see people from all over the world, which is appropriate, because we really are a global community, and we have to think globally on these issues. And that's why we're here from New York, joining you in Ireland, as people who've lived through this, who fought it and who won. And we fought it without the public health studies that we're so lucky to have now, and the science that backed up what we'd already were seeing anecdotally. So it's a very different landscape that we're fighting it in, and we're all glad to join you as our family in our world family, to protect the planet, our water, our fellow creatures, and fellow human beings.
Mm-hmm. Thank you, Mark. And yes, it's wonderful to see people joining from all across the world, with Philadelphia, New York, Buffalo, Donegal, Leitrim, Dublin, all across Sligo, Monaghan, everywhere we're seeing people join, and thank you so much for that. We're reaching out to you for help, and when we see you join us, we feel like you're listening and we're being heard. And we really want you to listen, to bear with us now this evening while we explain our situation, because if you don't know what's happening here, you can't help us. So we are wishing you well. We are thanking you for being here, and we're wishing everybody joining good health, and we need you to wish us good health and well-being and peace also. So without further ado, I'm going to pass to Dr. Kathy Nolan, and between Kathy Nolan and Carroll O'Dolan and myself, we're going to talk to you about the first primary issue of two issues tonight, and that is public health and well-being. So Dr. Kathy, would you like to take the first slide, please? Thank you.
Sure, thank you very much. I'm a pediatrician by training and worked in New York to help people understand the threats from fracking. And we had the opportunity in New York, as you have here, to stop fracking by a regulatory mechanism even before there was legislation in place. So just like we had to protect New York, we want all of Ireland to help protect Northern Ireland here. My role has been from the beginning to convince myself first, and then as I became convinced of all the harmful health impacts of fracking. And initially I had the hope that somehow fracking could be done safely, so that if there were economic or other benefit from it, we could have that and just not hurt people along the way. It's quite clear to me that that's not possible. If you look at this slide, you can see why that is. The image on the right shows there are local impacts from chemicals, the silica sand in the materials that are used to do the fracking, social disruption, noise, lighting, and then water quality that extends regionally, and air quality that extends local, regional, and global. So if we don't look at those harms, we're hiding the truth from people. And it is possible by treating fracking as some other business to avoid the looking at the health impacts. And so this is why this petroleum licensing that is currently being considered is a decision point. And it needs to be a decision point informed by the knowledge that we have about the health impacts and the environmental impacts. So if we could move to the next slide. So on the right, you have a diagram that shows that the chemicals and the air pollutants and potential water pollutants from fracking affect every system of the human body. And this is primarily through air pollution initially, but also through water pollution when the underground aquifers are contaminated. And water can also be polluted by fracking waste. So there are immediate harms from fracking and there are long-term harms from fracking. One of the difficulties is with drilling through the ground and going through water layers is that over time, the casings made of concrete that should keep the contents of the well away from the water and away from the air at the when the well comes above ground, though those well casings can crack and there are leaks in that system and there are leaks all along transport systems of these gas. More than 50% of wells leak at 15 years and further down the way. So we have about 15 years of good research. I think we're going to see even more harms being documented as we go along because the equipment is going to continue breaking down over time. But we already know that there's risk of cancer, there are severe respiratory impacts, neurologic impacts, skin disease, and very severe outcomes in pregnancy of women who are living near these sites during their pregnancy. One of the things that can be ignored is the noise and light pollution and the social upheaval that accompanies this activity. That trauma is shown in virtually all the studies, even before we could prove some of these more medically linked adverse outcomes. Every study shows that communities where this industry comes in experience trauma through primarily noise pollution, light pollution, industrialization, and earthquakes. Earthquakes can happen even at fracking sites, not just at fracking waste disposal sites, as we've seen in England. And the threat of potential earthquakes, even the shaking of the ground that can come from these underground explosions that are used to bring up the oil and gas can be experienced by people as traumatic. And there's some studies that show that people who live near fracking sites in Oklahoma actually have more car accidents. And the hypothesis is that they're just traumatized and that their actual ability to drive becomes disrupted as reports in Oklahoma of earthquakes have been increasing over recent years near the fracking sites. The pollution goes hundreds of miles in both air and water. And details of this are contained in a document, the Compendium of Health Harms from Fracking, which I have helped edit. We're about ready to release an 8th edition. And you can search for that online just as the Compendium of Health Harms from Fracking. So clearly there's a direct impact on public health, and there's no way to make this safe through regulations. You really can't get far enough away from it. And the nature of the activity requires underground explosions that are not really able to be controlled and whose impacts cannot be controlled. Calling it something else like low carbon or renewable or green hydrogen, blue hydrogen, that is not going to help us actually address the impacts on the ground. The next slide. So in New York, the Concerned Health Professionals of New York and other groups worked to convince the Department of Health in New York that they could not give permits, our equivalent of licenses, because they couldn't prove that they were going to be able to safeguard people. So the Department of Health teamed up with the Department of Environmental Conservation and said, no, we won't issue these permits. Essentially, we won't give a license. Several years down the road, we've now also passed legislation to ban fracking in New York State. But we had the protection from that rejection of the permitting very early on. And what we called for was that there be an independent professional health impact assessment before any place in New York would be considered as a site. And we've called for that. The Concerned Health Professionals in New York have called for that for the United States, in Argentina, where there's a Concerned Health Professionals of Argentina group, and around the world. This is how you check in with your local conditions to see if there is a way to address the health impacts of this industry. So if you just look at a high level, you won't see particulars of geography and the nature of the communities that might be targeted for oil and gas exploration. It's important to look down at each individual community and define the specific harms that will come with the industry, and really ask the honest question, can we prevent this, or could we mitigate it, take care of it in some way? So that means bringing in national and international standards to make sure you're doing that work well. You've got to involve the public. You've got to look at the inequalities in the particular community that was being considered. And I think existing trauma is completely relevant, because trauma adds to trauma. Any policy that is going to be implemented must improve our health and well-being, not merely just not harm us. And it's important to do this process of evaluating the impacts comprehensively and not just look at small pieces of the issue. And you have to look at the full life cycle of the industry, including well failures down the way, because those harms will come. They just may not be as immediately obvious or evident. And you have to look at socioeconomic impacts, losing farmlands, losing other sources of economy that already exist in a region, trying to bring in something supposedly to help, but that may destroy the existing economy. And with fracking, the well production tends to be short term. It's a very limited. And so you have what are called boom and bust cycles, where you may have an initial benefit and then have the community desolate afterwards, because every other industry has been driven out and the fracking industry cannot sustain itself over time. So I'll hand it back to you, Dianne, I think, for some of the considerations locally there.
Yes.
Oh, there's a question that came in of when would the 8th edition of the Compendium be released, and we're expecting that in the next month or two.
That's lovely. Thank you, Kathy. And thank you to everybody who's joined us since at their beginning. Just to say that we're recording this for social media and for releasing later on. And thank you to Deirdre, working away in the background there, sorting us out with all the technology and the support from Friends of the Earth, and of course the support from Frack Action, without whom all of this wouldn't be happening. So getting back to the health impacts assessment in Northern Ireland, something we don't have, as they're about to consider the policy that will mean licensing. So, you know, there is a basic legal principle that you cannot do harm to people. It's part of an MLA duty. It's part of a duty of elected representatives. And a health impact assessment, a HIA as we call it, is a formal set of protocols that are used to forecast and thus avoid harm. The World Health Organization describes a health impact assessment as a combination of procedures, methods, and tools by which a policy, program, or project can be judged as to its potential effect on the health of the population and the distribution of those effects within the population. And, you know, the Department of Health in Northern Ireland describes it as an important tool to judge the potential health impacts of a policy, especially on vulnerable or disadvantaged groups. And that's our own Department of Health in Northern Ireland. And Northern Ireland policy is for health in all policies. And it works with the Irish Institute of Public Health. Next slide, please, Deirdre. So the Institute of Public Health in Ireland have a set of guiding principles for health impact assessments. And that's actually really important because that whole health impact assessment, when we look at what the set of standards were for New York, right? It was about participation. It was about the ethical use of evidence. It was about equity and equality, sustainability, and that really comprehensive approach to health that's so vital to pick up on what's really happening here of the health population of Northern Ireland. And, you know, that was a reassuring set of guiding principles that we can see there, but we can't quite get hold of to actually bring into this situation. Next slide, Deirdre, please. So, you know, just to, you know, for people joining us, a lot of people joining us from across the world, you know, it's very important to realize that this situation, I'm sure you've all seen and read about the troubles in Northern Ireland. And there's a statistic about having one of the worst, highest rates of post-traumatic stress disorder in the world. And you might think, how did we get to that? Well, there's 35 years of violence at a time when we've seen 3,700 people killed and over 47,000 people injured as a result of that conflict. There was 36,000 shootings, 16,000 bombings, and 61% of our population here had a traumatic event, were impacted by this. And that impacts the well-being of the community in Northern Ireland. And females especially are more likely to suffer PTSD. And when the Irish Centre of Human Rights did a report on the fracking impacts, that was one of the findings, that it predominantly impacted women and women's health most of all. You know, we have, as a result then, seeing a lot of women in that group where we see that we are the world leader for prescription drugs for antidepressant use as a result of all of that trauma. You know, 53% of those people who've experienced a traumatic event develop mental health issues. And that trauma is transgenerational. As you have parents and, you know, who have suffered a lot of trauma, you know, then that passes on down through the children. And there's been a lot of studies done on this. And we're putting all this up on the Lamp for Mana WordPress site so that you can read more about this. But we're still seeing youth now experiencing a lot of the paramilitary style attacks and violence and living in that fear. And, you know, 95% in segregated housing and 93% of children still in Northern Ireland in segregated education. So next slide, Deirdre, please. Now, this one I'm going to pass back to Dr. Kathy on because, you know, it is about policy makers need to being aware of the link between trauma and illness. And that policy making is the whole key to the situation that we're at the moment. So Dr. Kathy, if you wouldn't mind commenting on that slide, please.
Yes, this is very troubling and important research. If you just focus on the left-hand column, this is a wide range of disorders that people can experience. And the first column to the right is the prevalence or the amount of that condition that we see among those who have experienced a conflict-related event. And if you compare that column to the last column, among those who have not experienced any traumatic event, you can see that trauma in almost every condition, arthritis, neck pain, allergies, heart attack, high blood pressure, asthma, there is a much higher incidence of those conditions in people who've experienced trauma. In the middle category, in the middle column there, this is prevalence among those who have experienced a non-conflict related event. And some of those events too can exacerbate or make a person more susceptible to these conditions. So you'll see that the percentages are higher in the middle column than to those in the column on the right, the control group, if you will. Those of us who don't have any major event that would be picked up in this study. What I'm concerned about is that the conflict-related events and their impacts may be additive to other types of non-conflict related background susceptibility. I'm
sorry, Dr. Kathy Nolan's seems to have frozen there in her reception.
Or even synergistic. And so we risk adding trauma, the field of trauma medicine. These conditions are, if additional new traumas are encountered, they become worse. So this research suggests that that is an adverse impact that we need to consider and try to avoid.
Yeah, and certainly we're thinking very much about the precautionary principle in related to those harms and the existing harms, and then the potential for adding cumulative impacts on top of that and cumulative traumatization of the community. I know when we had the industry here before, it was already very traumatic, even the short time that we had them. Next slide, please, Deirdre. Thank you, Kathy. Internationally, Northern Ireland and its people are often perceived as having emerged from a conflict because it's not major events on the news. But the transmission of poor mental health and prejudices within family, the role of community, social identity, emotional security, the types of ongoing violence and impact and other adversities that appear to have an impact on child, they have an impact on child development and adjustment, and in some way may reflect the cyclical nature of the trauma transmission that's bringing this transgenerational trauma right down into our children. And what's very important from the reports and the studies that we're seeing is that policymakers need to be aware and conscious of this pattern to understand and support communities. Next one, Deirdre, please. Now, if we had a health impact assessment, and they zoomed in down, and so because they're talking about this high level approach that they'll take from a report somewhere in the UK or from reports abroad, and it would never show up what our reality is here in Fermanagh, apart from having all the general statistics of Northern Ireland. It's a cumulative, there's an intersectionality and cumulative nature of this. We see in a study that was done in recent years by Dr. Declan Bradley from the Public Health Agency in Northern Ireland. When they did the study of the community here for a Pathfinder project, they found that women's life expectancy here is falling, and there's an increase in preventable mortality and a marked increase, a very big increase in lung cancer. And we're the only part of Northern Ireland where that is increasing. Circulatory disease, 15% higher than the Northern Ireland average, a 33% increase in alcohol-specific related deaths in the last 10 years. And 81% of our community have below average access to healthcare. And we have the highest rate of over 65s living below the poverty matrix, with one of the lowest rates of GPs and the worst impact, here on Northern Ireland. We have the worst hospital waiting lists in the whole of Europe, and the worst impact is in our community because we're so remote, and we have a very high radon area. So this is what the kind of thing that, if we did get that health impact assessment that we're asking for, this is some of the things that would be showing up in that. But of course it's not, because they're not wanting to show that. And you've got to try and layer on the impacts on top of that. Next slide, please. Deirdre, thank you. Right. So what's happening to us now? We had a question in the chat there from Emmett, and this was what it's happening. We have a system at the moment that is a process that can't protect people. The University of Exeter did a report on the Department for Economy, which are busy issuing licenses and everything, and they have a statutory duty to promote gas. But the other thing that report showed was that there was a heavy influence from industry in that department, and the governance wasn't even appropriate. And these are the people in charge of this policy. So they decided to research before they formed their policy, and they wanted to have a comprehensive review of local community health impacts. But when they commissioned that research, they didn't ask for anybody to have any qualifications or experience at all in health. They only wanted to be informed on making policy for the petroleum sector. That was all the essential experience that they asked for. And of course, no experience of public health. So they fitted the criteria. When you write a document like that, you get what you ask for when you control it, by setting your criteria. And they got their oil and gas consultants, and when that leaked report came out eventually through Extinction Rebellion, a report was leaked, and it showed that they didn't do anything. They didn't do an SEA, they didn't do an ELA, and they did not do a health impact assessment, despite what the questions from the minister came back as. Next slide, please, Deirdre. But here's Mr. Lyons answering questions in January. Through Jerry Carroll got us some of these answers. The Public Health Agency and the Department of Health were asked by Hatch, these oil and gas consultants, if they could contribute. Because they were busy with COVID, they couldn't. They didn't. And that was the end of that. And then, he was talking about, he said that they look at the impact on local communities and everything. But he says that, the public health assessment is based on published evidence from the UK and other jurisdictions. So we have nobody qualified to do a health impact assessment, nobody doing a health impact assessment, and nobody going to do a health impact assessment. And this is the one thing they do not want to talk about. Next slide, please. Now, this is Mr. Carroll O'Dolan's slide. So if we could get Dr. Carroll O'Dolan in, that would be wonderful. Thank you.
Hello, everybody, and thanks for having me on here. Thank you, Dianne, and to the whole team, and for Frack Action and organising this. So my name is Dr. Carroll O'Dolan. I'm a local GP family physician living in this area, working locally. And the real question is, why are we here tonight? Why are we going through all this? It's sort of hard to believe that we have been faced with this issue, that we fought off fracking 10 years ago and were successful. And now we're back because they've repositioned themselves. They've dressed up an old horse in new clothes, and they're saying to us, no, this is different. This is blue hydrogen. This is going to be carbon capture. So there's going to be all these different things. Whereas I seen a good thing there just from Mark Ruffalo. It's like putting lipstick on a pig. It's the same business as it was before. So if it was fracking 10 years ago, it's going to be the same. The health impact assessments have been mentioned to us there. The government's plan is that they want to develop a policy of licensing the petroleum industry. And then they said, well, we have to have a report. They've done this Hatch report, which was a very dubious piece of work to begin with. There was no public health impact assessment done. The Department of the Economy said that the Department of Health and Public Health Agency were not involved because they're too busy with COVID. I couldn't agree more. I've been very busy with COVID as well. But what do you do when you're busy with one public health impact emergency? You deal with it and you go on to the next one. So the idea that they would just go ahead with the licensing because the public health people were too busy trying to save lives somewhere else so they won't notice what we're doing is unacceptable. I just wanted to flash out a few little things that was mentioned earlier about the health. When you think of this health and how does it boil down? So it's not just in Fermanagh. This would be in a Bermuda Triangle around Belfast, from Belfast to Armagh City up to Cookstown, going right across Lough Neagh, the largest water system, largest lake in the UK. Infant deaths rose 6-fold in Utah over a 3-year period after the advent of fracking. 6-fold. That's shocking. Low birth weights and increased premature deaths associated with mothers living near frack sites. The cause was air pollution. So we're not talking some airy-fairy stuff far away. This is your sister, your mother, your family, you as a pregnant woman are going to be sitting there around Belfast, around Fermanagh saying, oh my God, what is this government doing to me? There's 2,000 of these pages. Increased congenital heart defects if a mother lives within 10 miles, 16 kilometers of a fracking area. That's the whole of Fermanagh. That's the whole, this area is going to have a frack pad every 2 kilometers. 91% increase in thyroid cancer in living people near shale gas developments. And that's another thing. They keep changing their name. We'll call it high volume hydraulic fracking this year. Now we call it shale gas development. And then we call it the blue hydrogen setup. It's all the same thing to us. We need to protect our health. So we have asked for a public health impact to be done. That should inform policy. And if you have a full public health impact assessment, which has to be done, we cannot develop policy and allow licensing without that. If we have that full public health impact assessment, it's quite clear that there's no way you could go ahead with this. 3 months ago, the British Medical Journal, a very renowned publication during the COP26, the editorial says, the problem is clear. Fossil fuel combustion has caused health crisis. Fine particulate air pollution from fossil fuel combustion leads to an estimated 8.7 million premature deaths per year. 8.7 million. As of yesterday, there was 5.7 million people killed in the COVID pandemic hitting the world. 1.5 times as many people are dying every year from the particulate matter from fossil fuels alone. You're not even looking at the bigger climate changes. This is fossil fuel particulate matter. So we cannot be sitting here and seriously contemplating that while the rest of the world is trying to get out of this business, in this province, our government is planning to set up from scratch a fossil fuel energy industry in the middle of a crisis. Imagine that. Just think about it. Setting up a fossil fuel industry in the middle of a climate crisis when the rest of the world is saying, how do we get out of this and give these jobs to other people? We are going to put everything at risk. Number one is our health. Number two is our well-established industries, specifically farming and tourism. So what do we want from our government? Well, it's up there in front of you. And I'm just going to look, with all these plans, but the elections, so the quotes given by Minister Lyons, as of this morning, Minister Lyons has resigned, and it looks like it'll be an early election in Northern Ireland. So it's morally and ethically wrong to be going down this route. We have to be aware that the trauma is not just of the troubles. If you think the last 2 years, everybody is coming out of a major trauma of a pandemic. And the idea that you're going to introduce this very damaging and divisive industry, which can only do us harm, is madness. It's like rubbing salt in the wound. So we need common sense. We need our MLAs to follow the advice of international recommendations for public health impact assessment. The reason that people have been pushing so hard against one party in particular is because one party is going hell for leather. The other main party, Sinn Féin, have said that they are very much opposed to this, but we need them to stand up and say quite clearly, we will not allow this to go ahead, that we will push for the public health impact assessment. And if and when that comes through, it would be quite obvious from then that there's only one obvious solution. We need to ban petroleum licensing. Because make no mistake, if petroleum licensing goes ahead and then in 2 years' time we change our mind, these companies were going to take us to the cleaners. The taxpayer will end up in court having to pay back millions upon millions, probably billions of pounds, because they said, you told us we could do this in 2022. Why did you say that? So the precautionary principle is very important. So first of all, in medicine, you do no harm. Then if there's a risk of harm, you've got to move very cautiously and see is there evidence out there. As was mentioned earlier, the evidence is out there. If the government says we don't need a public health impact assessment, we have to go on what's out there already, it's quite obvious from the USA, this is not safe, it can't happen. If they say they want a proper report, it can't be the Hatch. The Hatch report was something like fell off a back of a lorry for 50 quid. It's not the sort of thing you're going to base the next 10 years of people's health on. you know. So precautionary principle, we need to protect our communities. And most importantly, we need our MLAs to stand up and say, we are not in favor of this. In the next 2 to 3 weeks, there's going to be manifestos put together by all the parties. We need them to put clearly in the manifesto, written down in black and white so people can read it, that they are opposed to the development of a new fossil fuel industry in Northern Ireland. Call it what you will. We don't have it here, and it's not going to be of anyone's benefit. If you take in the bigger picture, the only ones who benefit is the company. The other 99% of us suffer. So we need community consent that we have to have, and that community consent so far from what we've learned in the information we sent in to the Hatch report is that this is not wanted on many levels. Ask your MLAs for a written pledge at your door. This will go up later on the website. A written pledge, you can keep it at the door, and when they arrive, you ask them to sign it that they will vote against petroleum licensing, that they want a full public health impact assessment run along WHO guidelines, not a Hatch report botched job. I could go on forever. I'm a Belfast man. We can talk forever.
Thank you.
But we need to realize I'm at the forefront of this. I see elderly and young patients suffering from all sorts of issues. And the last thing I need is another nail in the coffin of rural health. Thank you.
Thank you very much, Carroll Dolan. And that's very important to hear from a medical expert here and a medical expert in New York as well, because New York can tell us what's coming. And Carroll can give us an inpoint here. And just for the record, it's First Minister Paul Givan who's resigned today. And I think Mr. Lyons is still going to be there. He's very much in our minds at the moment. And that's important because he is the one facilitating for the industry. And that's the reality. So we've had 10 years of threat here in this region, you know, with license applications and court cases and everything. And we are grateful to the Ulster Unionist and Alliance for their support, but we need the right actions in the right direction from Sinn Féin, and because it's about a head count within the executive, right? And okay, we're in for elections now, and there'll be a slightly different head count perhaps, from the outcome of that from those elections, right? But it's not going to change this. And we have had, you know, statements from Sinn Féin saying, we will oppose and we will, you know, do all of that definitely, you know, but the license is decided by policy, right? They can approve, they can oppose the approval of licenses by the Department of Economy, but that's not what's going to happen here. The policy that's going to be made in the executive by Sinn Féin, and there's enough at the moment, if that assembly will still be going with Ulster Unionist and Alliance, to have enough numbers there to outvote the DUP, right? And so it's about the policy being made in the executive. Then the licenses have to be issued. You can't, that's just it. You know, the policy will let the licenses be issued, and that will start the drilling and the fracking, right? That's where it happens. It's about policy, and that's made in the executive, not in the Department for Economy, as the Sinn Féin are writing to us at the moment. And, you know, as First Minister, Sinn Féin or Deputy First Minister, or whoever's there, both of those have to agree the agenda, right? They have the power to veto that, right? And they can make control of the agenda, and they can decide, okay, we're not going to consider a policy until we have got a full health impact assessment in place. And they can work with Alliance and the Ulster Unionist Party to make those decisions, and they can work to ban petroleum licensing and make that the policy, right? Now they will say we brought a bill to ban, but it came very late. That fracking bill that they brought was very late in this mandate. And it was only for some rocks, right? Only certain types of rocks, leaving other ones all exposed and open for exploitation. And, you know, they blamed the Bills Office and the Petroleum Act. But you know what? A new bill, a new law, you know, can be amended to, you know, to outdo, you know, supersede a different law. And, you know, if you know, that's who makes the law. Is it the civil servants making the law, or is it the elected representatives making the law? We need politicians to act here and make the laws to protect the people. You know, we need actions on this. Where's the actions to suspend the pro-gas statutory duty and get control of that Department of Economy, who are destroying mining communities up the road as well, and our communities as well? We have a lot in common. That's so critical. Those actions that were all spelled out in the University of Exeter report, we need to see actions on that. We can't have the industry in control of the Department of Economy, and it's a Sinn Féin chair in that Department of Economy committee. There's so much to be done, and we need to happen. Can I have the next slide, please?